So this is how the agenda looks like. So we will start with welcome and introduction of Dr. Kalpana Nagpal, and we have Vikrant Grover on the call, who is our clinical sales manager. Then we will go ahead with Dr. Kalpana's talk on my journey with Da Vinci, followed by question and answer, and then we will have close. I would request participants, if you have any questions, please feel free to put it in the chat box, or you can even email me, WhatsApp me, and we can take those questions. So with that, over to you, Vikrant. Over to
Thank
you.
you, thank you, Rahul. Good afternoon, everyone. Welcome to this session. Thank you so much, Dr. Kalpana, for accepting this invite and taking time out from your busy schedule. I have this privilege to introduce Dr. Kalpana Nagpal to all of you. She's the senior consultant and robotic surgeon, Department of ENT and Head and Neck Surgery in the Prastha Apollo Hospitals, Delhi, which is one of our flagship centers for robotic surgery here in Delhi. Dr. Kalpana has performed more than 170 plus robotic ENT surgeries. And I was speaking to Varun. Varun is our colleague who's closely working with Dr. Kalpana. If I'm not wrong, ma'am was trained somewhere in the end of 2017. And since then, I mean, we all know how this year has been, but 170 odd robotic ENT surgeries. She has done her fellowship from Georgia US Memorial Medical Center. Her work has been published in American Journal of Rhinology and Indian Journal of Otolaryngology. She has done special work for allergic fungal sinusitis with Dr. Kun, sinus surgeon from US. And she's also participated in various workshops related to management of OSA, which is obstructive sleep apnea, which is, I think, a very underrated disease state, which a lot of us don't even know and understand. And she's the faculty on this topic for in various national and international forums. This is all about her introduction, but I would also like this opportunity to kind of go a little bit beyond this slide. I know Dr. Kalpana Nagpal as one of our most passionate Da Vinci surgeons here in Delhi. The kind of work she's doing, she started her work with obstructive sleep apnea. She does a lot of thyroids and also advanced surgeries like laryngeal procedures, which in some simple terms has to do with the disease states of the vocal cords. So I think this whole spectrum she's covering with Da Vinci surgery, the whole ENT spectrum, and I think I'm yet to see a more passionate surgeon when it comes to propagating this technology for the patient, better patient outcomes, and also in general, also whenever I get a chance to meet her. In fact, me and Varun met her last week only in OPD. So the kind of passion she shares about the technology is phenomenal. Without much ado, I would like to invite Dr. Kalpana Nagpal to take us through this session. Over to you, ma'am.
Thank you. Thank you, Vikrant. Actually, let me thank all the organizers of Intuitive for today's lecture. And it's an excellent initiative. You know, for people who have just joined Intuitive Surgicals, they are looking forward to a great career. And these kind of lectures will make a huge impact on their lives and it will motivate them certainly. Once again, thanks Rahul, Vikrant and Varun. Varun, a special thanks to him because he's been with me from day one and he's such a sincere guy and he's there for everything that I ask for. You know, if I tell him, I even sometimes get angry with him, you know, if something is not working, but he takes it in a good stride. And then, you know, we've been having this journey together for the last 3-4 years and it's been wonderful. Anyway, thanks to Intuitive Surgicals. And before I start this,
Thank you, thanks for kind words.
You're welcome, Varun. So before I start this lecture, let me give a small quote of Robert Frost. You know, a lot of people would have read novels of Robert Frost, but there's one quote I always like, you know, like I entered the woods and I saw two roads diverging. So I took the road which was less traveled, and that made all the difference. And today, if there is a difference, even in my department, if I'm the only one doing, it gives me certain pride that, you know, I took this difficult road. There were challenges, yet the challenges were met with, you know, positivity, and every hurdle was met with, and something positive came out after each hurdle. And today, here we are, as Rahul has already mentioned, nearly 175 robotic surgeries. And It is not about just doing the surgeries, it's all about the outcomes also. So I would like to slowly, in the form of a PowerPoint presentation, tell you how the journey has been and explain things for you.
Ma'am, do you want me to share the slides?
Let me try once.
Okay, ma'am.
Yeah. So my introduction was already there, but I would like to add few things. I've also published a lot of robotic surgery cases, and some of them were unique in the sense they were the first time cases, in the sense the first lingual thyroid that I performed with robotic, Da Vinci robot. And in the world literature, it was supposed to be the third one. So like that, there are 2, 3 other cases which were rare and which were in the kind either first or second or third and not more than that. Like for example, recently we did robot-assisted schwannoma removal. Again, in the literature, you'll find only 2 or 3 cases in the entire world. So all these publications I could manage during this pandemic because we had more time, and so that's how we could expand our publications. So, hello to all of them who are listening to this. And now, this is the, first of all, everybody thinks it is just glamour and nothing else. It is for the patients who have been each time proving to us and telling us, yes, there is a difference. So, let me continue with it. Now, this is the place where I got trained, Severance Hospital, Yonsei University, South Korea. Now, for people who want to get trained in robotic head and neck surgery, unfortunately, there is no training center in India. I mean, we're planning to start one very soon so that we could have more ENT surgeons, becoming robotic surgeons. But at the moment, it is one of these. Either you go to Paris or you go to California or else Seoul. So this is how it is. And I excellent. I mean, apart from the language issue, Yonsei University was great. And you can see the quote on the right side, patient first always. You may be doing anything, you may be having X number of degrees and you may be having X number of, technology or any kind of training, blah, blah, blah. You might say, I have done FRCS, FRCP, this, that. Ultimately, it is the patient. For the patient, they would ask you a simple question. Surgery, will it be okay? Will I be cured? Will the incision be okay? Is the scar okay? Will it be healed? Will it be visible? These are the questions that usually come up apart from the anesthesia thing they're concerned. Now, this is the alma mater. I work at Apollo Hospital, as already mentioned. Now, this is a very large corporate hospital. We have SI system, but fortunately, we are soon upgrading it to XI system. So SI system hasn't given any problems for us in head and neck. Now we have had 5 instruments. Now to explain to you people who are mostly non-medicos, I guess, why 5 instruments is we want very tiny instruments to go inside the mouth, inside the orifice, natural orifice, without collision. Because we need at least 2 arms, one arm for the right side, one arm for the left side, apart from the endoscope that is introduced. Now, if you're introducing 3 different things inside the mouth without giving any external cuts, obviously you have to be very careful about not having collision. So that is why we need tiny instruments. Now, this is the OT setup that you can see at Apollo. Now, I'm sitting at the surgeon console, which you can see is several feet away from the patient. Patient is lying on the table. Anesthesia machine is near the foot end, and this is the patient cart, which you can see, which is basically set up for TORS. TORS is what? It is trans-oral robotic surgery, oral meaning mouth. So any surgeries inside the throat without giving external incisions. The robotic arms are going inside the throat, even into the lower down in the throat, reaching inaccessible areas, like base of tongue, larynx. So all this without giving external cuts. Before this Da Vinci was introduced, it was impossible to reach these areas. Now, these are the fine tips of the instruments. They look big in this picture, they're actually very tiny. So as I said, 5 mm. Now, except for the thyroid surgeries, we use 5 mm. In thyroid, we use 8 mm. And no point mentioning the names of the instrument, etc. But I want to tell you, these are wristed arm movements, meaning it's a telesurgery, right? You're sitting several feet away. So your hand movements, which means your commands, each time the surgeon has to give a command. And the finger movements of the surgeon are translated into the robotic arm instrument movements. So it's mere translation and it is a telesurgery. Now, which means the surgeon has to understand the anatomy very well, has to know all the steps very well. And unlike the myth which the patients have that the robot is performing the surgery, it's not true. As you can see, we have to still keep sitting at the console and do every step very carefully without injuring the structure. So it's not, just like that performing something. It is not like one fine day robotic surgery happens or surgeon can become in 24 hours. You have to have done traditional surgeries for a very long time, and you have also got to be trained in endoscopic surgeries. Apart from all this, interestingly, psychomotor skills are very important. Why I'm saying this is, there are some surgeons who have had training for robotic surgery, preliminary training, but are unable to perform because unless you have the psychomotor skills, high hand-eye coordination along with the brain, it is very difficult to pursue and continue. Now, these are some of the indications in ENT. I do not know if all of you can understand the terms, but I can simplify saying there are some benign conditions and there are some cancerous conditions. So benign conditions like example, snoring and sleep apnea. As Rahul said, many people are not aware about sleep apnea. Sleep apnea is a very dangerous disease. Now, sleep apnea is the root cause for many disorders like brain strokes, heart attacks, cancers. 10 to 20 times the risk increases. So anybody who's snoring in your family, you have to advise for a small sleep study. And then you come to know whether the patient is suffering from sleep apnea. Earlier for sleep apnea, it used to be only wearing an accessory device on the mouth. It used to be CPAP and BiPAP machines. Again, thanks to Da Vinci, because of this access to base of tongue, it has completely changed the perspective. Now, who likes to wear a big added, this device on the mouth every night, all night during sleep? Nobody wants to wear that big device. So people are not compliant. And that is why they are opting for robotic surgeries. And now we're getting patients, like last week we had one from Bangalore. Today I have had a patient who has just come from Jamnagar. So like that, we're having patients national and international. Now, thyroid surgeries, parathyroid and thyroid, wherever there is swelling. Now, these surgeries, with the robotic surgeries, you're not having any external scar that is visible. Either the incision is given inside the armpit or it is given behind in the hairline. Otherwise, thyroid surgery, all of you know, there is a necklace-like scar which is there permanently. Now, similarly, cancer surgeries. Now, cancer surgeries, most of you would have seen there is a lot of disfigurement after surgery with all these traditional surgery because the jawbone has to be cut. If you have to reach a cancer in the backside of the tongue, you have to cut open the jaw and then, go and reach the cancer and remove it. With the robotic invention, of course, we have to select cases. It's not for advanced cases, but early cases, without cutting opening the jaw, we're able to reach the entire site and we're able to do a wide resection without much complications, without extended stay in the hospital, without blood transfusions. So the other indications which I've mentioned are all with those advantages. So more or less you can see the advantages. No cosmetic deformities, as I mentioned. It's so depressing for the patient to have a big cosmetic surgery. Nowadays, even young patients come with cancers. Nobody wants to have something visible like that, disfigurement. Reduced blood loss. In all the cases that I've done, thanks to God, I haven't had to arrange any kind of blood transfusion before the surgery. Reduced post-operative pain, except for sleep apnea surgery. The other surgeries, patients have never complained of pain. In sleep apnea surgery, we do counsel the patients very well, tell them it's for about 2 weeks, and otherwise you're going to get excellent results, but please bear with us, there is pain. But interestingly, again, Russian patients and African patients have never had pain. Now, reduced risk of wound infection. Now, in pandemic, robotic surgery has had excellent advantage over traditional surgeries. Why? You're not touching the patient. You're away from the patient. Even the assistant and the nurse don't touch the patient. The operative site is actually not touched. So neither the patient you're touching, it's safe for the doctors and the staff also, because you're not touching, and it is safe for the patient because we are not handling their tissues directly. So there is no question of any viral infection or any other infection that is being transmitted mutually. Like even if the patient has HIV, you're sitting away and watching and doing it. So there is no risk of such transmission of HIV, which means AIDS. Okay, the other things like short hospital stay, lesser GA, and as the learning curve gets better, the duration of surgery is much lesser. Now, what was in the past and what is it now and what is it going to be in the future? Now, technology is advancing so fast that now we have newer robots, which even Da Vinci has come up with a single port robot. No, so you don't have to put 3 different instruments inside, like endoscope separately, instruments separately, everything is in one arm. So imagine you get so much more space. So this kind of advancement happening every year. I mean, it is really difficult to catch up with technology, but at the same time, if you catch up with it and if you learn more and more techniques, you can keep expanding your indications, and that's how it's making a huge difference. There are certain challenges in India, for example, like insurance cover. We have been fighting for it for a long time. Even though urologists have been doing robotic surgery for a long time, somehow robotics were not covered by insurance. But again, recently there is good news now. Apollo Munich has started reimbursing, they're giving it robotic instruments, consumables are covered. Some other insurance companies have also agreed. So we are getting there. I mean, we are now almost like Western countries where robotic surgeries are being covered entirely. So that challenge is slowly overcome. But patients are still not aware. So we are doing our best, Intuitive also helps us, and also we are taking help of media and even digital media, since everything nowadays people are digital savvy. We are, now and then posting small videos and teaching people, creating awareness about robotic surgeries. Sometimes your own colleagues do not know in what particular cases they have to refer you. So only after you have compared the pre-operative outcomes with post-operative outcomes and then shown them, that is when they start believing you, that is when they start trusting you, and that's how slowly the referrals increase. So all these published cases are also going to help because they're visible on Google. Now I get a lot of email queries, which, last year there were not so many queries. Now there are more and more people who are understanding that Da Vinci is making a difference. So there are a lot of challenges. Why? Because I was the first one who started in ENT. In fact, only first of my cases was mentored by a oncosurgeon, Dr. Dabas, who's in Delhi. Now, apart from the first case, from the second case, I had to be on my own. So it is probably, I want to give you all one small advice. Any field you take up, any challenge you take up, if your goals are very clear and if you're determined, despite the challenges, you will achieve it. So your goals have to be clear. My goal right now is to have a big institute inside India to train more and more ENT surgeons and other surgeons from India and abroad. So for a successful program, as I said, one is of course our own Intuitive team. I've mentioned Varun, who has been helping. Apart from that, a dedicated team of surgeons, assistants and nurses. Now my co-surgeon, Dr. Noor, he has also been there from day one. And now slowly there are other surgeons also who are observing from different parts of the country. Dr. Anil D. Cruz, who's a director of Tata Memorial Hospital. Now, if he has not understood that there are advantages, why would he come and observe? So he's also showing a lot of interest in this. So now together we are going to expand cancer surgeries, more and more robotic cancer surgeries for ENT and head and neck. So most important is repeated self-assessments, which means I have to keep improving my own learning curve. Along with it, I have to teach more and more surgeons. And unless and until we have many more ENT surgeons doing, We cannot have large volumes in the country. After all, India has to be, competing with other countries also, as in sports, as in movies. So why not in robotics? We also have to be leading. So we have to build strength in others. Every new case that I have done, sometimes I can see that there's a lack of confidence in most people. Most people would try to discourage. Ma'am, I don't think this is possible. You know, most of the time it happened with the first case of every first case, which means thyroid case or the parathyroid case or hemangioma or any case that we started, even larynx, that's voice box cancer case. First reaction usually would be, no, no, it's not possible. So despite those kind of, discouraging words, if the leader is sure that one person can, if one person is enough who has confidence, then rest of the team members will automatically start believing in you, and automatically the team strength builds up, and that's how we can provide more good outcomes, and more, cases can keep happening. So positivity is very important, and one has to be strong because there is a big lobby of the traditional surgeons. Why? Because traditional surgeons are majority. They would always try and discourage robotic surgeons because robotic surgeons are not even 1/10 in numbers. So you have to, when once such a big lobby is there, obviously most of the times the cases, people will try and cancel those cases. But despite that, unfortunately, because of the pandemic, number of cases came down because, overall the cases came down. Everybody was getting scared to come to the hospitals. Otherwise, we've had a nice. Now, one thing is important, as I started with my first slide, patient always. Yes, the hands are so much important. It is not that the robot is there to keep playing on the patient. You cannot experiment. Every patient is important. You comes in and the rest of the patients. It cannot happen like that. Every patient is important. So you have to treat them with all your empathy. Robots are really very friendly. So use them in a very nice selected cases, and do them understand that all the complex situations where human hands cannot be performing or reaching those difficult areas, please use them in that once you're trained, and keep explaining to them on a 2D screen so that others can also see, even the anesthetists can see and believe and see what you're doing. Thank you. I would like to share a few testimonials so that you can hear it for yourself from some of these patients about what they have, had advantages. I would request one of you to share those videos.
Ma'am, do you want me to put that link?
Yeah, please.
Okay, ma'am. Just a moment.
Ma'am, why Rahul puts the link on? I wanted to know how many surgeries have you done so far in ENT?
Yeah, about 170 surgeries.
Ma'am, any unique case that you have, like in a working class?
Yeah, I told
or usually what's the age
cases
group?
as couple of cases have been the first kinds, in the sense hemangioma on the backside of the tongue. Okay, so which means we call it base of the tongue, that is inside part of the tongue. So hemangioma is a very vascular lesion, which means if you touch it, will start bleeding. Normally people arrange at least 2 to 3 bottles of blood, and it's kind of a big surgery, traditional surgery. You give a big cut in the neck, and you prepare 2 assistants, prepare these blood transfusions, tell the anesthetist it's a complicated surgery and all that. But because of this robot, we did not arrange for transfusions. This surgery took me only 25 to 30 minutes. It was one of my colleagues in the department who actually referred me. And there was no bleeding at all. The entire video is like bloodless. And, that was so heartening that day. And when I found in the literature, there was not even one case in India which was performed like this, without scar and without bleeding. So, and in the world literature, again, it was second case. So like that lingual thyroid, this is a patient who came from Nepal. And she's a young girl, 16 years when she came to me. And, obviously parents would not want any scar for an unmarried girl, And this lingual thyroid, first of all, she didn't have the diagnosis of lingual thyroid also. It was interesting that she went to various people, physicians, surgeons, nobody could diagnose this. And when she came with breathing difficulty, finally they even labeled her as a functional case, asking her to go to a psychiatrist. So unfortunate. When I did an endoscopy, then I found a big lesion, a nice spherical lesion more than 3 to 4 centimeters, which was sitting again on the backside of the tongue in the airway. And that is how she was having breathing difficulty, especially in the night when she was sleeping straight. And when I gave her this option, it was, that those were preliminary cases. Probably I did only 6 or 7 before that. And parents were very happy when I said there won't be any scar. And till today, she's very happy. There's no recurrence that happens in lingual thyroids. And in the literature, world literature, it was the third case. And similarly, the schwannoma, which I did recently, robot assisted, it's again a very, it's a rare tumor, but it is present in between vital structures. Vital structures means like carotid artery, vagus nerve. These are very, crucial structures in the neck. Even if one of them gets injured, patient can have stroke, patient can have breathing difficulty, diaphragm will not move. I mean, so many complications can happen. And these tumors, you cannot leave, some tumor behind. It can recur. And these tumors, people are dreaded in the sense they don't want to go and operate because it is right in between the branches of the carotid artery. All of you know what is carotid, right? It is a major blood vessel which supplies the brain. So this was lying right in the junction of the bifurcation of the carotid. Now, initially, after doing some ligation of important blood vessel, like, internal jugular vein, which we call in the neck, that ligation was done only so that we had good space. After that, the entire video will show you that the dissection was so precise that we did not have to touch the capsule, meaning the covering of the tumor. And the planes were so clearly seen. The nerve was so many times magnified, because you see 10 times magnified vision. And the carotid, which is beating, you're seeing the pulsations of the carotid. So without injuring any of them, it came out in toto. Bringing out a tumor in toto is the best, because there are no chances of recurrence. The cells are not spreading here and there. And, and patient, again, she was also happy because this was a female patient. No, I gave the incision right in the hairline behind the neck. So I think it may be there in one of these links. Let us see.
Yeah, sure, ma'am. I'll just share that now.
That's really interesting. Thanks, ma'am. Thanks for sharing that. We will soon connect with you. I think I'll talk to Varun and talk to you on how do we amplify it, as you mentioned.
By the time Rahul is picking up the link, ma'am, if you remember last week when me and Varun were there, we were talking about our colleague who can help us get some earned. Leela is the person. I think we all three of us need to catch hold of her with such interesting.
Please catch hold of her tightly.
In fact, we will do that, ma'am. We'll soon talk to you.
It's very much required. Yeah, Leela, we need you.
Okay, ma'am. I'll just go ahead and play it.
Okay. This is a patient from Ethiopia.
How did you experience? Okay.
Can you hear the voice as well?
Just 1 second, Rahul, before I start this video. Can I tell?
Yeah, sure, ma'am. Please go ahead. I've paused it.
He's Mr. Selamo from Ethiopia. Now he has my face on his DP he says, from now onwards, my DP will have only your picture. And he's so happy because of that he's doing this. He was snoring for several years. Okay, and rest you can listen to.
I came from Ethiopia. I am suffering for snoring, starting from the childhood until now. But in our country, there is shortage of materials. I need to go here, Apollo Hospital, to get robotic surgery. When I get robotic surgery, torse and septoplasty, Dr. Kalpana Nagpal did for me. After that, everything is okay. Now the time is checkup. During the sleep, no snoring, no choking, all are normal. In our country, so many people is suffering like this. God bless her politeness. Thank you for the last 4 months. I got good sleep without any challenge. That is why I come here for checkup. Thank you.
Mr. Selamo came from Ethiopia 4 months ago for snoring disorder. So we did a polysomnography and then upper airway endoscopy. Polysomnography showed moderately severe sleep apnea. So we have all the indices here. Now, after 4 months, he has come for a repeat sleep study. The treatment that we offered was transoral robotic surgery for base of tongue reduction, and along with it, he underwent palatoplasty and septoplasty. Now, after surgery for snoring and sleep apnea, we offered a repeat sleep study. So we got the repeat sleep study now, and the repeat sleep study has shown significant improvement in parameters. His AHI, that is apnea hypopnea index, has come down drastically. He's almost cured now, and even the other indices like arousal index and even the NADR, that is minimum oxygen saturations, has improved significantly. He's symptomatically much better. His wife says he doesn't snore anymore, and there are no jerky moments during sleep. He has a quiet sleep. It's very gratifying to see these results. So, how transoral robotic surgery has changed the future of sleep apnea treatment. So,
Yes, ma'am, please go ahead.
Yeah. So instead of continuing this patient's video, we'll go to the next one. But before that, I want to tell you one thing. So he's one of the patients who has given this kind of, testimonial. But there are various others. There's one Sudan pilot, he flies from Kenya to Sudan almost every day. So as a pilot, he had this challenge of, keeping himself alert, because sleep apnea, you keep getting drowsiness during the day. He's written, someday when you tell me, I can share with you that letter and you can share it with others.
Sure,
He's
ma'am.
again, he's written for many, many years he was suffering, and he's totally, until today, every day he drops me a message, every day. And since he's a Christian and he believes in Christianity, every day he'll send me a good, message from Bible also. But what I'm trying to say is he's so much thankful that he's in connection, he's in, regular contact, and that too every day. There's another patient from Turkmenistan. She has, named her child like my name. Like
Wow.
this is a Russian patient. This is another interesting thing.
That's amazing.
Thank you. And so what I'm trying to say is I presented these cases in the World Sleep Congress in Prague. So with data, that is comparison of preoperative sleep study versus postoperative sleep study. And in the World Sleep Congress also, it was greatly appreciated. Let's go to the next video.
Sure, ma'am.
नाम संगीता त्रिवेदी है। मैं बिहार से आई हूँ, मुजफ्फरपुर जिले की हूँ और मैं यहाँ न्यू दिल्ली इलाज कराने आई थी अपोलो। मेरे पास थायराइड ग्लैंड था जो बहुत बड़ा हो चुका था और खाने में निगलने में दिक्कत हो रही थी, सांस लेने में भी दिक्कत हो रही थी। यहाँ आके पता चला कि इसका सर्जरी, रोबोटिक सर्जरी होता है जो कल्पना मैम करती है। मैंने यहाँ आके अपना ऑपरेशन कराई हूँ और 4 दिन हुआ है ऑपरेशन। न कोई चीरा है न कोई निशान है, बिल्कुल फिट और करा के जा रही हूँ। यहाँ का सब पूरा व्यवस्था बहुत अच्छा है। यहाँ पे डॉक्टर, सिस्टर सब बहुत अच्छे हैं। यहाँ पे बहुत ख्याल रखा जाता है पेशेंट का, सब चीज़ का ख्याल रखा जाता है। मैं मैम को धन्यवाद देना चाहती हूँ।
Go ahead, ma'am.
Yeah. So you can see she's a young female, and just 4 days after surgery, she was sitting with me. So can you, even looking at her face, you can make out she's not suffering from any pain or like there's no visible scar. Could anybody in the world guess that she had surgery 4 days ago? That to a major surgery like thyroid surgery.
Ma'am, I'm just curious, ma'am.
Beauty. Yeah.
I'm just curious if this patient would have been operated with a conventional method, ma'am. How long would it take to recover back, like the way she's sitting after 4 days?
Yeah, usually it takes a week, they say complain of pain in the neck. Then you see one long incision here. Apart from
Big
that,
cut,
you
right?
see an extra, kind of scar mark because we put drains also. So the drains are
Okay.
also coming out from the neck from both the sides. So apart from the main incision, there are some holes here also. So nothing, her neck is so nicely visible, which is clean without pain and anything. So her cut was inside the armpit.
Okay.
This is all amazing, ma'am. I think we should definitely talk to media about it. I think not many people will be aware of these kind of surgeries available.
They're not
How
aware.
cosmetically, how
Actually,
beautiful it is.
these videos have to be boosted by you people if it's possible.
Sure.
I gonna do that.
Even if each one of you share it on your own Facebook or other Instagram, or at least the message goes like, more and more people will come to know about it. And why not? After all, we're doing something good for the patient. As I said, patient first, right? We're not just trying to prove that there is a new technology. The new technology is giving something good to the patient and it's beneficial. That's how even I'm believing, and that's how even I'm continuing with it. If there was not anything realistic like this, then why would anybody continue a program, isn't it?
Ma'am, my belief has actually increased 1,000 times more after hearing this patient. That she's sitting like awesome after 4 days, which would have not been possible if she would have gone through conventional surgery.
Right, absolutely.
ये इन्होंने मुझे अच्छा बना दिया।
As you can all see, she's a young female, Sangeeta Trivedi. She's had transaxillary robotic hemithyroidectomy. Now, the main advantages is it's scarless. There is no scar in the neck.
Ma'am, shall I move to the next one?
Yeah,
The
because I've already said this, right?
Sure, ma'am.
This is patient from Sudan. Next one.
I'm Dr. Kalpana Nagpal, Senior Consultant in Indraprastha Apollo Hospital, New Delhi. She's my patient here, and she presented to me with a swelling in the palate, and this has been slowly growing over a period of 2 to 3 years, and it has been painless, but she was concerned about the swelling in the palate, and then therefore we got her investigated, and the CT scan showed a big tumor in the palate. And we also got the fine needle aspiration study, which confirmed that it's a benign tumor. Now we plan excision for her. We explained to her about both robotic options and non-robotic options. She chose robotic option, and post-robotic surgery, today is the first day. There has been no complaints of pain. In fact, today is an additional day which they have chosen to stay. Otherwise, she could have been even discharged today. The feeding tube is just kept for a day. It will be removed now in another 1 or 2 hours. There was no bleeding during surgery. The planes were very well visualized. The tumor was so fantastically seen under 3D vision, and the dissection was so neat and clean only because of the 3D vision that the surgeon had, and even all the assistants and staff in the operation theatre could watch it on the 2D screen. The dissection, as it proceeded, there were minor micro adhesions that were seen in the planes, and then those were removed. And at the same time, the bleeding, could be taken care of because this robotic machine, we have different foot switches where we could control bleeding and we could do the cutting and coagulation at the same time. There are many different properties in the surgeon console. Like we have a binocular vision. And this is all without touching the patient. I was sitting few feet away from the patient, and I'm sitting at my own comfort, so there is no fatigue for the surgeon. And I'm looking at the screen, and unlike the myth that the robot operates, it's not true. The robotic arms have to follow the surgeon commands. So every command I give, the robotic arms move. So this is a fantastic discovery. So this telesurgery is, amazing, and the patients have advantage that the duration of stay in the hospital is just very short and without any bleeding, no need of transfusions, and primary closure was easily achieved. So she didn't require any flaps either.
My name is Afra. Now I am feeling good.
Yeah, first we came from Republic of Sudan before 7 days, and we met Dr. Kalpana. Actually, someone of our friend in United Arab Emirates introduced me to Dr. Kalpana, which is a famous consultant for ENT surgery. as well, I was reading a lot of her, in her website in Apollo Hospital. My wife, she's suffering from the swelling in palates, so that we came here in India. We met her, and she gave us a lot of informations and about the surgery. Now the surgery done yesterday, and my wife, she's feeling well, and the feeding tube will be removed tomorrow, and there is no any bleeding, and tomorrow will be her discharge. Thank you very much for the hospital, and thank you very much for Dr. Kalpana. She is very kind, and she was following the patients all the time. And thank you for the staff of the Apollo Hospital. Thank you.
See, can you hear me now?
Yes, ma'am.
For a tumor surgery like this, palate is what? There's a hanging structure inside the throat, right? Everybody knows that hanging structure in the backside of the throat. That's called uvula. The area above that is called the palate. So she had a big tumor in the palate. Normally, when you remove the tumor in the palate, all that area which is now deficient after removing it, you need to call the reconstructive surgeon, which means the plastic surgeon. Now, in her case, because of this robotic surgery and precise surgery, we were not removing any extra normal tissue. We were only precisely removing the tumor, and it was easily, nicely possible to mobilize the area around it, which means we said, like, you didn't require any extra flaps. Flaps are what is you mobilize tissues from other areas to cover the primary defect. Whereas in her case, it was not required only because of this robotic surgery. So again, thanks to Da Vinci. For all my patients, I'll keep thanking Da Vinci. So again, she had feeding tube only for one day. They went back to Dubai. Again, they keep sending greetings now and then. So like that, each one is a nice story, and all of them have become so close to us. And it's a very good feeling after all, fantastic feeling. And hopefully in the coming few years, we will have newer indications, and we will have many more surgeries that happen, which means I want the volumes to go up like 100 times more than what it's happening now. And I'm sure it will. It is just that, this pandemic gave us one big break, but I'm sure slowly and slowly, many more patients will come. Thanks for the patient listening. I hope all of you enjoyed the talk.
Thank you, ma'am. Do we have any comments, questions for ma'am?
Oh, we have a lot of questions, but I'm not going to ask her. I'm going to meet her in person and talk to her about full detail, cases. I think it's very interesting. For me, definitely, it is like, not many of us are aware these kind of, the surgeries can be done, and then also sensitizing people about it, right? I think that's very important. So I think that's where we need your definitely help, your ma'am. I think I'm going to contact you very soon to, how do we build more stories? Thanks, Rahul. you insisted that I join. So thanks a lot, ma'am, for sharing all the inspiring stories.
My pleasure, entirely my pleasure.
Ma'am, I would say that it is so inspiring to hear that we are working in a company which is actually making a difference in people's lives. And of course, ma'am, heard something which I have never listened before. So hearing it from you actually make it more powerful. And I certainly believe, ma'am, you are a torch bearer in India. And I believe that very soon we would have a lot of ENT surgeons who would be following the path like you. So thank you, ma'am, for being a leader in our country, ma'am.
Thank you so much, Ralph. Thank you, Vikrant. Thank you, Varun.
Thank you, ma'am. Thanks for taking time out. And
Thanks for
I mean, although we, at least me and Varun, we know what you are doing and about your passion, but again, listening always kind of gave me goosebumps, and we are even more charged up and excited to help more and more patients, ma'am.
Thanks a lot, Vikrant.
And in fact, when you said patient, ma'am, in fact, when you said patient first, ma'am, I think one of the mission that we have at Intuitive is the same, and we follow the same what you people are following it. So that makes us connected more with our mission statement of the company, that we are able to support surgeons to help the patients, ma'am.
In fact, all of you might have had a chance to go to Sunnyvale in California. where this intuitive surgical's office is. And if you read, there is a nice mission on the wall. Almost every wall has one mission, and very nice sayings. I took pictures also of those. Wonderful place, actually. You get really motivated. So many engineers on the job, and every day they're manufacturing so many robots, and so many robots were getting released every week also in the US, with the US being a rich country. But unfortunately this pandemic, but anyway, pandemic has changed lives for everyone, but we all have to stay positive, stay safe, and things will be improving soon.
Yeah, thank you very much, ma'am. Thank you for sharing your time today on the call, ma'am.
Thank you.
And thanks all the participants here.
Thank you. Good day.
Thank you.
Thank you, ma'am. Thanks a lot for your time and
Thank
effort.
you. Bye.
Thank you.
Thanks, Rahul.
Thank you, Leela.
Bye-bye.
Everybody.
Thank you.